Good morning, everyone, and welcome to the National Domestic Violence Fatality Review Initiative's webinar. Joan Eliel and Dana Jackson will present More Than a Vision, Native American Domestic Violence Fatality Review. Before we begin, I have a few housekeeping items. As you can see on the slide, we have disabled the public chat feature. If you have a question, you can type it into the box on the tab marked Room. This will open a new tab connecting you with the moderators. The moderators may not reply directly to you, but your questions will be collected. If your question does not receive a response during the session, please feel free to email us using the contact information at the end of the presentation. Please make sure your volume is turned up on your speakers. You can also adjust the volume using the bar above the video button. If you have audio issues during the event, you can click on the microphone icon with the red gear at the top of the video screen to run the setup wizard. You won't be able to hear the presenters while running the wizard, but this alleviates many of the issues participants experience. At this point, I'm going to turn it over to our presenters, and the 90-minute webinar will start very soon. Thank you.
Okay, good afternoon, everyone. Thank you, Stephanie, and thank you to NDVFRI for sponsoring this webinar. Dan and I, on behalf of the entire Montana Native American Fatality Review team, really appreciate the opportunity to share our experiences and to encourage others to develop similar teams. Last of all, thank you to all of you who are listening, who are obviously giving up 90 minutes of a fine summer day in July to hear about fatality review. So I'm guessing you are truly sick individuals. I'm not sure, but actually I'm just kidding, of course. In reality, I know that you are only the most dedicated and innovative people who are truly committed to preventing domestic violence fatalities, and you are tuned in, and you're exactly the type of folks that we would like and think that would make an excellent team members. I think just to make sure that everything's working okay, we'll start with a bit of audience participation. How many of you are familiar with fatality review or fatality review teams? I think there's a little hand button at the top of your screen there. Everybody's working on that. It looks like a majority of you are, which is kind of what I thought, since you probably received this invitation to the webinar through the NDVFRI links. Montana itself, I think that there are about 41 states that have at least one fatality review team, and I think some states such as Florida, for instance, I know have multiple teams. And if you'd like to know more about your state, you can go to the NDVFRI website, which the link is ndvfri.org, and they have a map of the United States, and it lists the states that have teams and more information that you can find out about those teams. Montana itself has two teams. It has the state team and it has the Native American team. And it's largely due to the work of the Montana State team and their findings that precipitated the creation of the Native American team. So as an introduction to fatality review teams in general, and because Montana does conduct their reviews a bit differently than other states, we wanted to begin by showing you a short documentary video that was done a few years ago on the Montana State team. So Stephanie, could you go ahead and cue that video, please? Okay, folks, I think we're going to go ahead and I think the majority have watched it, and those of you who did join late, if you could, you can always go back. The link will be on the website, and you can finish watching that film at any time. It doesn't really matter how many times I've watched that video. It always seems to affect me, and it also reinforces my commitment to fatality review and to the importance of this work. And so giving that background now, I do want to dive into the crux of our topic today. And obviously, as you've seen, we already have a very awesome Montana state team who have actually done reviews on Native American fatalities, which kind of begs the question, do we need a specific Native American team? Those of us who've worked in the criminal justice system for any length of time know that domestic violence is not limited to a specific group. Domestic violence really doesn't discriminate based on race or socioeconomic status or gender, sexual orientation or age or religious affiliation, but it is perpetrated by abusers from all social groups. But with that being said, we also have heard that Native Americans and Alaska Natives are 2 to 3 times more likely to suffer physical or sexual abuse than other races. And of course our question is, why is that? Now statistically, there's not been a lot of hard data to back up those assertions. I think it's getting better, and we are starting to get some of those statistics. But because Native Americans are Montana's largest minority population, and in our office in particular, because we have had a close working relationship with the tribal communities, it was on our radar, I guess, to pay more attention to the Native American fatalities. So Dan and I are going to go through a few PowerPoint slides to show the differences in data between the state team and the Native American team, and I'm going to turn it over to her so you can listen to her talk for a little bit.
Hi everyone, this is Dana, and the first slide that we have here is a slide of the tribal nations in Montana. Let's do another one of these interactive, I guess, waving of the hands. How many of you on this call are from Montana? I did notice that we do have actual members of our team on this call too, so clearly they're from Montana. Harlan Trombley, Winona Tanner, Misty Dorr, and Matt Dale, they participate on this team. So we do have a few. Montana's big. It's the 4th largest state in the Union, and we have 7 reservations. As you can see, they're very large reservations, the largest being Crow, which is about 2.2 million acres. And I want to point out that of all of our 7 reservations, the only one that is not subject to federal jurisdiction of major crimes is the Flathead Indian Reservation, which is home to the Salish, Kootenai, and Pend Oreille Indians. They are what is called a Public Law 280 jurisdiction. So for purposes there, all of the homicides that would be prosecuted would be done by Lake County. On all the other reservations, if there's a homicide, it would be prosecuted by the U.S. Attorney's Office, which I am a prosecutor. That being said, most of the cases, Indian Country cases, are done in our Great Falls Division and our Billings Division, and Fort Peck Reservation, which is in the far right-hand corner of our state, the closest court is Great Falls, which is 320 miles one way. I just wanted to give you a sense of the vastness of our state, because I do think that that might be something our team needs to take into consideration when we're talking about how domestic violence looks different in a place that is very rural and in sometimes remote. In regard to the rest of the state, this slide shows that we have a total of 62,398 natives, give or take 1 or 2, I suppose. And on reservations, the majority of our natives here in Montana do live on reservations. And as you can see, 38% live off reservations. Our largest tribe in terms of population is the Blackfeet Nation, which is 14%, followed by Flathead, Confederated Salish and Kootenai tribes, which also has the Pend Oreille Indians, and Fort Peck following. Of course, Fort Belknap is our smallest population, a smaller population than Rocky Boys, even though Rocky Boys has a smaller land base. And I thought this was a neat graph just to show you the percentage of non-Native Americans that live on our reservations. And it's probably not shocking to those who know Montana to see the Flathead Indian Reservation is the most skewed in terms of non-natives living on that reservation. It's a more populous area in general in the western side of the state, but I do think it provides an interesting contrast to the other reservations. And one more slide on some of the demographics here in Montana. The population of Native Americans is going upward, and I don't see that trend changing at all. And I'm not sure why, except that I know that we love our Native babies here, and there's always a lot of folks promoting babies and having babies on our reservations, and a large percentage of the population of our reservations are under 18. So we just interesting trend in that when you look at nationally the fact that some of the states are emptying out of their rural areas. In Montana, that's true, except on our reservations.
So we're going to go through now and kind of do a comparison of our state teams and the Native American team. And I apologize that Dan and I are sharing a phone, so this might be a little tricky here on trying to both of us chime in here, but we will do our best. So the Montana team started back in 1999, and thereabouts, and there really wasn't any one agency that was tracking fatalities, domestic violence fatalities at that time. And so Matthew Dale started in the Office of Victim Services to compile a list that has carried through to this day of all of the Montana intimate partner deaths since 2000. And so we have that list that actually goes clear through 2000. And so this is the slide that you're seeing here, of course, is just since 2010, the list. But I want you to kind of take a look at it, and you can get a few ideas of some of the trends and recommendations just by looking at this chart of what the trends are in Montana. For example, if you take a quick look over to the far right-hand side where it talks about, and we'll go through the top here, the first section there are the victims, and it's then the victim's age. We have the death that the event happened, the date the event happened, and then we have whether it's a homicide, suicide, or a familicide, which is when, of course, children also are killed. And then lastly is the weapon or method of death in that. And so if you take a quick glance down there, it becomes really apparent that the most prevalent one in that column is a firearm. Also, we'll contrast that then with strictly the Native American homicides since 2000. And again, same thing, the victim here is the first column, and we've got the columns titled there. And if you look at the far right-hand column again, you'll look down, and it's a little bit different. It shows that a knife was the more prevalent weapon that was used in these events. We're going to show a few more slides that has the same information but are just kind of packaged a little different way. For example, this is just what I was talking about. On the statewide side, it shows that on the statewide fatalities that a firearm was used 77%, whereas on the Native American side it was 25%. And again, the knife was used 50% of the time. So just kind of an interesting difference from the state team versus the Native American deaths. And feel free to chime in anytime. On the next slide is according to gender. Again, on the statewide side, the male is the perpetrator 70% of the time. and a female being the perpetrator 30% of the time, which I think is even high in comparison with other states. But then on the Native American side, it's the female who has the larger percentage of being the perpetrator 58% of the time, and the male 42% of the time. The type of death. The statewide team, the homicide-suicide is the more common with 48%, followed by homicide with 39%, and then familicide when the children are involved as well is 13%. Again, that contrasts with just the homicide, one death on the Native American side is 83%, and the homicide-suicide being 17%. And there have not been any familicides in the particular data points that we look at as far as children being killed in this situation.
And this is Dana again. I think that these last two slides are just so compelling to me from my perspective as a federal prosecutor, but also from the perspective of a person growing up on a reservation. The gender issues are very interesting, and I think that other members of our team will, we want to know why there are more female perpetrators in Indian country than in other places. And I will say that based upon a couple reviews that I have participated in, our language started changing when we kept talking about perpetrators versus victims, because it was clear, at least to me, that the so-called perpetrator was also a victim of domestic violence. And these are the types of things I think our data is driving what we need to do in terms of finding recommendations down the road. But I do think that's a profound statistic to show that we have a much higher percentage of female perpetrators of these kinds of crimes in Indian country. This other one, the lack of familicides, is also incredibly interesting, and I think we need to dive down deeper and see why this is true. And Joan and I were, Joan was presenting at a class at the University of Montana a couple of weeks ago, and some of the students were making some hypothesis on this, and because of the nature of the family structure might be an explanation as to why there's not familicides, or we haven't experienced those, at least from our perspective as Indian country in Montana. So those are the kinds of statistics that drive what I think our team is very interested in getting to a deeper level on. And if any of these statistics jump out at you, please send us your comments in the chat section, or add those comments to the question and answer time, because we're really interested to learn more, and part of the recommendations are going to be for us to do exactly that, learn more. So just a few thoughts on those two slides.
On the next slide, we look at the range of the victims. Again, in Montana is a little bit unique because there's a perfect bell curve of fatalities that have occurred, and that's usually comparing with other states, not usually the case. There's more of a younger demographic that usually has the higher percentage. Again, comparing with the Native American one probably follows more of what the national trend is versus what the state has to show. On this next graph, it shows the number of deaths, and kind of just in a chart form of how it has progressed through the years. And of course, we'd like to take credit for the zero ones, but then we don't know how to explain the number of deaths on the other years. In Indian country here is the second one below here, and we went several years, 3 in a row without any deaths, and then at the end of last year we had 2 that were about a week apart in different reservations that occurred. And in Montana itself, it's 2015 has been a really terrible year. We've had the highest number yet of fatalities. This again shows our state and the demographics, and it has, as Dana had mentioned, the western part of the state is the more populous area, and so therefore you would expect to see the larger number of homicides events occurring. Also, many times when you see the larger dots, those are our larger metropolitan, if you can call any city in Montana metropolitan area. But this one that's clear up in the northwest corner is kind of an anomaly. It's a little place called Libby, Montana, and I'm not certain what the population is, but it's not large, and it's pretty remote and rural, and they certainly have their disproportionate share of events that have occurred there. The state team has not done a review there yet. There is intentions to do that, to see what's happening up in Libby. But as far as the Native American events, again, no one place has a lot of them, but as you can see, the shaded areas around the state are the reservation communities, and you can see several dots that do coincide with those reservation deaths. And this slide just brings those out more, and so you can kind of see the areas that have experienced more homicide events, and these are strictly the Native American ones. And this is putting them back together again to kind of further illustrate. Now I'd like to kind of go on and talk a little bit about our team. And what we have tried to do is, of course, get representatives from each of the tribal nations across our state. But we kind of double dip, not only in roles and responsibilities, but also just kind of the awesome people that they are. And so we have different disciplines from each of the reservations. For example, we might have a tribal judge from one tribal nation and a tribal law enforcement from a different one. We are learning as we go along of what types of people to add. I think probably the most question that a lot of people have is what in the world does the state even have to do in this scenario, because it's mainly tribal and federal jurisdiction. Why does the state play in it? And I think you'd be surprised at how many intersections there are with the state. And actually, you know, we do have some resources that are available that can be utilized by some of the tribal nations. And so we have become, I think, an important player in this process as well. Also, our last review, we realized that, you know, Child Protective Services actually play a pretty important role in a lot of these situations, and so we recently are trying to add someone from that agency.
We also determined that we really needed more kind of Indian Health Services or health provider types. We have a wonderful psychologist on the team named Earl Sutherland, and he'll field all kinds of crazy questions that someone like myself might have, which is, what is FAS? You know, what is fetal alcohol syndrome? Why is it a syndrome? And so he's available for the team to, you know, provide just real good medical information. But in terms of looking at systems, we recently added someone else in addition to him who is an administrator for Indian Health Services, because I think when we start making more substantive recommendations on how we can intervene in situations where we potentially see domestic violence in advance of a homicide, I think that they're going to be key. So that was, I think, a lesson learned as well, is the importance of having a lot of variety of different disciplines in the system to help guide what it is we can ultimately recommend that might, you know, prevent intimate partner homicides. I say intimate partner homicides because that's what we've decided as a team to study There has been some discussion as to whether we want to expand the view of our fatality review team to talk about deaths amongst family members, like a brother, sister, or grandson, grandma, or those circumstances. It certainly might be something we want to consider down the road as a team, but as of now, we're just focusing on the intimate partner homicides.
Also, we have been very fortunate to have the support of the tribal leaders in this process. We did issue letters at the beginning of our team to each of the tribal nations to ask for their support. Also, the Attorney General went to the Tribal Leaders Conference to further explain what it is that we were doing and what our intent was, and the tribal leaders again gave their support to that, and I don't think every state maybe is blessed with that type of cooperation. But again, domestic violence truly is an issue in our entire state, and we do need to all work together in order to try to make a difference. The majority of our team members are Native American. The others, again, do fill in the slots of, like I said, the kind of the missing pieces of people that you need at the table. Your team that you put together is really crucial. A lot of times, too, I think people start out with Native American teams, and the former process has kind of been to go to the tribal leaders and ask for their recommendation. I started another team once upon a time, and that's the route that I took. And some very wonderful, neat people who I still keep in touch with today were part of that initial one, but they weren't the right people to be at that team, because you do need those very specific people and skill sets in order to move your team down the path. We again have been able to have some success. We would gladly share any of our lessons learned. There's certainly been some bumps and bruises along the road too, but for the most part, we are still a work in process. We definitely are at the stages of, again, getting all of our information together so that we can publish a report and some findings that will, we can give back to the Native American communities.
And this is Dana. I have a couple points I want to raise, and one is we do mirror the Montana team, which is why we really wanted you to see that video, in that we have the similar organizations represented here. There's other important ways we mirror the Montana team, which is we travel to the place where the homicide occurred. So our team will pick up and head to whichever reservation or whatever closest hotel is to the reservation to do that review. And we'll do the review in a hospital or whichever place has the biggest, conference room that can accommodate us. And what is wonderful about doing a review this way is that every single one of us on this team then will invite our counterpart, our local counterpart, to come on day 2 of the review, so that when we as a team have reviewed what we think has happened in the lifetimes of these people, we can then be corrected by the local team, but also bring them into the fold and have them tell us directly what happened, or what their perceptions are, or what they think the recommendations could be. And some of those recommendations, as was indicated in the film, are going to be local. And so that's a very important aspect of a team member, is as a federal prosecutor, if I know the tribal prosecutor had been involved in that case, and the tribal prosecutors on this team and I will make sure that they're part of the conversation on day 2. So I think that that's something I wanted to make sure you knew, is we are the team, but we make great efforts to get as much local information as we can by use of what we call the local team on day 2.
So I've got a final couple slides that I'm just going to show, and then we'll just open it up for questions. And really these are, once again, just kind of reiterating what we've said, that in Montana, that while approximately 7% of the state's population are Native American, they do make up 14% of the incidents, which is again confirms the data or the information that we have is that this does happen to Native Americans at a higher rate than other races. Statewide, 30% of the intimate partner homicides, the killer is a female, and then in country, that number was 58%. Off the reservation, men tend to use firearms when killing their partner, and women most often use a knife. And in Indian country, the female perpetrated deaths, knives have been used more than 80% of the time. In all of the ones that we have done with the Native American intimate partner homicide incidents, they have only involved Native American victim and Native American perpetrators. There has been no non-Native on Native or Native on non-Native incidents that we know of, and I know that that's different in different states. And again, as we said, there have been no Native American familicides. So do you have anything to add before we do questions? Oh, I do have another slide. Thank you. So overall, the intimate partner homicides in Montana, as far as the Native American ones, have declined in the past 2 years, until I mentioned that last November we did have the 2 IPH events on the 2 different reservations. But still, even with that, Native Americans do continue to be victims of intimate partner homicide at a disproportional rate in our state. Okay, I think we're ready for some questions.
The first question that I think has been posed is, and there's a number of you who are interested in this, which I think is interesting because I am too, why such large percentage of female perpetrators in the Native American community? Why is that? And is there any information we can get about how many of the Native women who were counted as the perpetrators were self-defending? And I will try to respond to that as best I can. I think we're still learning. And in regard to those cases that might be considered self-defense, those might not be charged, quite frankly. But in a couple of the cases that we've looked at where the female has been the perpetrator, they were charged because they thought the prosecutor thought there was requisite intent to proceed. That doesn't mean that there might not been a history of family abuse in these people's lifetimes, and I think that's what we're trying to figure out. And when we do a review, we start from birth to death. So we are trying to find out as much as we can about who this person was and what were their experiences in life that led them ultimately to this demise. We have learned quickly, especially from some of our Native folks on the team, that we might even need to look earlier. And we have brought that history to some of our reviews of who are the grandparents, what was their historical trauma that might have affected the way this person now is, and their expectations in life and their expectations of what a respectful relationship should look like. So I don't know that we have the answer to that yet, but I do know that it's one of the most important data points that I think that has been derived from this. And I know that there are a lot of folks who may have answers to this. One of the things as a team that we are trying to figure out now is, who do we want to come educate us? So we have been toying with the idea and maybe working at getting experts in the field to come advise us regarding what they are finding in this realm. And in particular, we're very interested in being better educated on historical trauma, where the ACE study is another thing that we're all very aware of and want to know more about, but also the effect of concentrated poverty. So those are the kinds of things that we feel like as a team we need to learn more about so that we can then reflect recommendations that are more consistent with reality. I know that's not a very satisfying answer, but the truth is we all need to get to the bottom of it. Do you want to take the next question?
I think Dana hit on this a little bit. The question is, I would want to know where fatalities and violence are higher in Native American communities, the number of community members who were sent to Indian residential school. And we don't specifically track that at that time. I think that that's a really interesting point that also would be maybe another data point to look at. Most of our victims, again, are on the younger side, so several of them have not been sent off to boarding school, but their parents certainly were. And we, as Dana said, we are looking into educating ourselves more about this type of thing.
Another interesting, I guess, side note related to that, and was raised, I think, in the most recent review we did, was both the person who was the killer and the victim in this case, they both were foster kids. And the perpetrator of this domestic violence homicide, I don't remember, but she was in and out of foster homes in outrageous rates. And the victim in this case, he was actually taken off the reservation at a young age and then came back at 18 to live and work on his reservation. And so that's probably an interesting data point for us to get at too. And when Joan referenced the need for child protection services representation on your teams, I couldn't agree more, because when we're taking a look at their childhoods, that's one thing, but there's always there's never not been children who are left behind. And so in terms of recommendations and the fact that these are children that were likely exposed to violence, we also need to be setting forth recommendations regarding the future.
The next question is, do any of the team work with perpetrators on a regular basis? I'm trying to think if we have anyone from a batterers program. We do have victim advocates on our team. We do have Harlan Trombley, who works with the Department of Corrections, who works with, again, perpetrators who are incarcerated. And so he has recently been added to our team, and I think, again, will assist us with his knowledge on work with perpetrators.
I also have a comment on that, and that is one of the, as was reflected in the video, one of the most powerful information we get when we are sitting as a team and learning about their lives are the interviews of the perpetrators. And not to be crass, but it's always very helpful when they're alive because you don't have the benefit of that in the homicide-suicide circumstance. So far, perpetrators have been very willing to talk to us, and I think that's because of the strength of some of our individual members who are very good interviewers. But from that perspective, yes, we have direct contact with those who have been the killers in these circumstances, and it's incredibly interesting and I think very helpful to us so that we can get a very deep understanding of where they're coming from. The next question is, it came out of Oregon. In Oregon, we have 9 federally recognized tribal nations. What was the process at the beginning to bring people together to start talking about initiating a Native American team? Do you have suggestions on where to start? I'm giving that to Joan since she's our star coordinator here.
again, I think I hit on this a little bit in the presentation, that we did do this a little bit differently than maybe at some processes do dictate, because you're working with the various tribal nations. I think you do need to have someone that is familiar with all of your tribal nations, and somebody who's in a position to have connections federally, tribally, and statewide. Probably my first team member that I selected was Dana. So, and she has connections all over the place. And again, of course, because she had both the federal and the tribal connections, she was huge in, again, pinpointing people to be on our team. Also, you know, through my work with the tribes, you know, I had certain individuals in mind who I knew would be awesome for the team. And so we started putting together the team slowly that way, and again, just looking where our needs were, where our gaps were, you know, geographically, where did we need someone from, and if we did not know or have a real good lead in cases like that, we did reach out to other people we knew for references on who would be a good person to have on our team that could represent that discipline.
And in Montana, it's the person, the team member is appointed by the Attorney General. So it's of the state, and that's just how we decided to organize it. And I think that that's a very important aspect to it, because it makes it really important when the Attorney General sends you a letter and says, thank you for agreeing to be part of this team, it's really important work. It was nice to have that infrastructure and that kind of gravitas in putting the team together. In that regard also, though, I attended some of the Montana team meetings before the Native American one started. So in that regard, I became a cheerleader for the effort because I had seen the process, had been part of it, and you know, was able to explain to people who may be like, what are we doing? Is this going to be a waste of my time? Is this just going to be a couple days of meetings that I don't have time for? I feel like my role as the federal prosecutor on the team is mostly to be a cheerleader and to make sure that people understand that this is really important work. I would recommend that for one or two of you who might have an interest in setting up a Native American team in your state or on your reservations, that you would go to those Fatality Review Team sessions and watch how they work. And I think we would be happy to give you recommendations on that. But also I do think the organization who put this on, and Neil Websdale and his staff, could direct you to other teams that you might want to participate and see how it's working for them.
Certainly anyone who is interested is welcome to come and observe one of our reviews if that is of interest. So I would put that out there. The last question I have here is, what would you say contributing factors are for the lack of research in Native American communities?
I'll try to answer that. This is Dana again. I think it's an outstanding question, because sometimes I think Native Americans feel like they're being studied to death. On the other hand, I just think that it's ultimately a difficult thing, because to do it right, you have to get to the reservations. And to really find out what's going on and get true data points, you have to be trusted. And I do think that that's part of it. I do see that there's funding available for different types of studies, but I don't know that these studies are necessarily defined in a way to promote the kinds of conclusions that we're hoping for. So I don't know if that's a good answer. I do think it's a question for academia as well, though. But generally speaking, I think that it's just really hard to collect data. Another part of it is, if you look at like the tribal court systems, it's all that, or you look at tribal law enforcement, sometimes it's all they can do to get from body to body, and I'm not exaggerating. Sometimes the violence is just so intense that you just have to react all the time, and you don't have the luxury, if you will, of kind of keeping track of what's actually happening here and why. And so I think it's a resource-related issue as well. I do want to make a comment because we haven't hit on it yet, and I'm a little bit obsessed with this right now, and that is the confidentiality piece of this. I think it's connected to your question on research, but also it's connected to our ability to gain trust with tribes and collect our data, but it also is just critical for you know, what you're actually looking at, the subject matter, which is confidential criminal justice information. So I think that in the context of research, finding out the data, getting your teams, getting engaged in the community, you need to really be thinking through what it means to be providing a confidential review. I mean, we will do a timeline on the wall, but then we take down all that data overnight in case, you know, the janitors have access or whatever it is. So I guess I would say that it's a multifaceted issue, but we sure do need to know more, because then, only then can we start directing our resources to better places. And my bias here is towards, you know, child protection and towards substance abuse and mental health services, and to programs that promote respect early on in elementary or even Head Start. That's my bias as a federal prosecutor. I have the benefit of reading pre-sentence reports that are done, you know, in advance of the sentencing, and it's just not shocking to see that majority of these folks who are considered perpetrators or are defendants or are convicted, boy, did they have a rough life. So that's data that we need to collect, and I think we're getting better, but we have a long way to go. Are there any more questions? Those are the ones that were sent this way. If you do have questions, you want to go ahead and type in the chat segment. Or comments. We'd love to have your comments as well. Right, and there's an ability for you to give applause if you want. To say webinars are very difficult. I have a hard time teaching on webinars because I have to reel in my kind of zany sense of humor when you can't gauge if anyone else thinks what you're saying is funny. But the good part of webinars is I'm wearing jeans and an orange t-shirt as a federal prosecutor, and you can judge me, but I didn't suit up because it was a webinar day, not a court day. Oh good, we have a question. The question is, what would you say the contributing factors are for lack of research? Oh, we just did that one. Never mind. Oh, what? Okay. Any more questions? Okay, it looks like we have a question regarding training Native American communities for purposes of gathering information. I think that that's complicated, and I will say that, you know, we are often we're blessed here to have wonderful tribal colleges. The reason why I say it's complicated is because everyone knows each other's business, but I think that there's a lot of folks who may not want others in their community to know all the details of their business. So I think that that's a very complicated thing to do. I do think that there's been a real effort to professionalize the types of research that's going on in Indian country, meaning, you know, what are the points that you're trying to get in a more academic way. I don't know. I don't know the answer to that. Joan, do you have any thoughts? She doesn't have any thoughts. I will tell you though, because you mentioned training, one of the good parts of this review or the recommendations piece of our review is we come up with ideas for trainings. And those are things we can act on immediately. Training for research. I honestly, quite honestly, have to think that through some more. And but maybe that's something we need to talk about as a team. We have some amazing folks on the team like Stephanie Ironshooter, who works with the SAMHSA grant on suicide prevention, and she's been able to point us to some very good academic type articles and people to help us kind of augment what we're learning with what has already been studied. Here's another question. One group found that suicidal thoughts and attempts is a precursor for domestic violence homicide. Do you see that in Native American communities, and at what rate? Joan, do you have an answer?
Not a conclusive answer other than saying that we do have, as Dana just mentioned, Stephanie on our team who is part of the suicide prevention team, and they're just really new as well, starting that team up. And so part of the reasons of bringing her on the team was the connection that she has with that team, and if we could find any correlation. Like I said, we're a brand new team too, so we're still learning. We certainly don't have all the answers. I wish we did. But we are still learning, and I appreciate your questions because, again, that gives us other ideas of things that maybe we need to look into and develop further.
I can answer that a little more. We have seen in some of the cases that we've reviewed that certainly threat of suicide is used as a tool of control. And I do see that in Native American communities. And the statistics here in Montana are very, very sad. First of all, if we're not #1 in the country, we're very close to it in terms of number of suicides per capita. And Native suicides are very high here too. So it's absolutely connected to intimate partner homicide. And in that regard, we definitely have seen throughout the Montana team, and Joan can correct me if I'm wrong, and our team, the Native team, definitely use of suicide as a threat to keep the couple together. If you leave me, I'll kill myself. Those kinds of threats. And so as to the rate, I would say a lot. And I think that would be another data point that maybe if there's a way of collecting that, we should. Maybe that should be something that we're asking the relatives of the deceased or the relatives of the perpetrator, had there ever been threats of suicide? That's an excellent, excellent point. The next question. Have you gathered great data? Oh, you have gathered great data. Well, thank you. Any recommendations on how to use it to educate the courts about lethality assessment and DV dynamics? Absolutely a recommendation I think we're probably going to have. And we have tribal judges and tribal prosecutors on our team. And one of the things that we see is many times there were a lot of frequent flyers to the tribal court system, both of the perpetrators and the victims. And I can't help but think that maybe that is an opportunity for intervention. And some of our reservations are dry, so there may be a disturbance in a house, right, where someone calls the cops. And what do the law enforcement do? They show up and they arrest a person for drinking, right? And so these people are hauled in. Well, maybe that was the easy charge, and no shame, no blame here, but maybe that was the easy charge, but maybe there was more going on there, and maybe that's an opportunity for judges then to, as part of their intervention or their arraignment or part of their processes to educate these folks regarding their lethality or the risk of lethality, should there be a sense that this is actually more than people drinking on the res, it might have something more to do with domestic violence. So I think that that's an excellent, excellent recommendation that I think that we'll be interested in. I think there's so many opportunities for education on lethality, and I appreciate it when I have my annual exam, when I get a DV screening, right? And so there's another potential opportunity for lethality assessment if the docs and the nurses and everyone's understanding that these folks who come in who may be part of a domestic violence circumstance are at risk. I do know that the Montana team had come up with some recommendations related to lethality assessments, just like in the video where they indicated that instead of having arraignments in the morning, they moved them to the afternoon. That gave advocates an opportunity to interface with the victim and maybe advise of lethality as well. And again, that could be a recommendation that is made by the organization, by the team. And Joan and I and others on this call, we also do a lot of tribal court training. So I think that there's definitely a real link there that hopefully we can do that and make a difference. Are there any other questions? There's a comment. Wonderful. Behavioral health care providers have challenges making connections between a suicidal victim, and that's in quotes, who is actually perpetrating and a danger to their families. I think that's right. I think that's right. Is there any other comment on that comment? Nope. Somebody commented nope. I think that's right. I just think, so much of our recommendation is going to be educating more on the ground and just frankly having more behavioral health care providers on reservations. The resources are very scarce, and so that's probably a recommendation as well. Provide more behavioral health care providers and substance abuse providers and preventative measures. Any other comments? I am happy for you to call me at any time, and I know Joan would too, or email me, and I don't know if our contact information is on a slide, but we can get that to you. I have a very limited perspective, but Joan certainly is the coordinator, so she could also connect you up with some of our team members if you wanted to visit with them about their experiences. And so here, Joan, I'll let you sign off.
Again, that's what I was going to echo. As if you feel more comfortable talking with another team member that is in your same discipline to kind of get their perspective and information, I feel fairly confident that I can speak on behalf of the team and say that they would very much welcome a call or able to assist you in any way we can. Again, we have not done our first report yet. Thank you for making several recommendations, which I think will help our team to kind of steer us as well. And again, this is a two-way street. We're here to help each other. So if there's any way that we can help any of you, and we'd just like to have your contact so that, again, maybe you can help us as well as we travel this road together. So again, I do thank all of you for all of your time today, and I do appreciate the National Domestic Violence Fatality Review Initiative team for sponsoring this and making this available on this webinar. So I'll go ahead and sign off and hopefully get brownie points for letting you go 5 minutes early too. So thank you very much. Look forward to meeting you down the road. Bye.
Thank you, Joan and Dana. As we close, I'd just like to mention that all registrants will receive a link to an evaluation survey today. Please take a few minutes to fill it out, as your feedback provides us with an opportunity to improve these events. I do appreciate your patience while we had some technical difficulties with the video. The webinar was recorded, and it will be posted to our NDVFRI website in the coming weeks. And you can see that link right there on the slide. The next webinar in this series will take place later this year, and we hope you'll join us. To receive announcements about our events, please sign up for our newsletter on our website. Thank you very much for coming today, and please feel free to contact us if you have any additional questions come up.